Hello, everybody. Dr. Feller here. I was just reading one of the chat forums, and one of my patients who I had done a FUT procedure on that goes by the name of Taco Lino West. I had posted a concern he had about his donor area and his scar, so I want to address that here. And he writes, I'm 5 weeks post-op and I'm worried about the section of my donor scar not healing well. When I get out of the shower and dry my hair with a towel, you can see a little blood on the towel. First of all, let me assure you that, and then you show a picture of it, let me assure you that that there's absolutely nothing wrong here. This is par for the course. This does happen. The little bit of bleeding you're talking about and what I see in the photograph is completely superficial. So in of itself, it's nothing dangerous. It's not going to hurt you. There's nothing for you to do about it. But I'm going to tell you what's happening here. Usually in a case like this, the bleeding doesn't occur 5 weeks after the surgery unless, usually two things. One, sometimes the skin when it's put together is put together flat. As it heals, one side, either the top side or bottom side, may contract more than the other in the healing process, and it might leave a little bit of a ledge here. And that ledge is easy for you to feel. And what tends to happen is people tend to chronically go back there and start touching and touching and touching it. And by the touching and moving, a chronic movement of it, it starts to break it down a little bit. And then you might get some bleeding if you take a towel and you put some good hard rubs on it. I know when I dry my hair, I give some good hard rubs up and down. So what you may be doing is splitting some of the superficial skin. In the end, it doesn't mean anything. It's not going to make any difference. It's not going to open up. I guarantee you it will not open. I've been doing hair transplants for 20 years, and I've never seen a wound open, not even once. So you don't have to worry about that. The other reason I've seen little bits of bleeding in the recipient, in the donor area, are due to small pimples that may form along the edge of the scar. And this is due to some of the follicles, hair, getting a little caught up inside of the scar tissue itself. And what will usually happen, as it usually happens whenever there's an ingrown hair, it'll cause a small eruption, like a pimple. And then that pimple begins to build pressure up inside of it. And then you just go back there and you touch it, certainly during a shower because you're washing everything. And you go back and you touch it, you add a little more pressure and it opens up. And you get a little bit of blood. And again, this is normal. This resolves on its own. By the way, this happens every day on people who've never had a hair transplant or any surgery on their scalp in their entire life. This is just the normal, everyday breaking of the skin. So it's not something you need to worry about. In a later comment, you were concerned that this might be indicative of the stretching of the scar. Well, it isn't. It really has nothing to do with that. Scar stretching really has to do with properties of the skin, particularly something called collagen. Collagen is to skin like rebar is to concrete. So if you have a low collagen content, the chances of your scar stretching is greater. If you have less collagen content, then rather if you have more collagen content, the scar's chances of stretching are much lower. If you have less collagen content, the scar will stretch more. When you feel the skin when I feel my patient's skin before a procedure, if they're extremely flexible, then they probably have a lower collagen content, and I warn them that you may have a bigger scar than average. Although even then, it's not 100% the case. I've had many patients with extremely flexible skin, fully waiting for the scars to stretch, and they wind up not doing it. But in the case here, as I'm looking at your photograph here, this is not indicative of scar stretching. You may stretch, you may not. I think it takes usually about 3 months before you begin to see if you're going to be stretching or not. So if you're just seeing this little eruption in one area of the donor area, forget about it. Don't worry about it. Your body's going to fix it on its own. But try to be cognizant of touching it, because a lot of people tend to, even when they're not in the shower, they tend to touch with their fingers. They're constantly and chronically inspecting it and touching it, almost obsessively. And when you're in the shower, the hands are clean. They've got soap and water on it. But during the day, anytime as soon as you touch a tabletop, you've got loads of bacteria on your fingers, and you start rubbing it into the area, and that will start to get into the pores, and that's how a pimple can form. And you get right back into this vicious cycle. Right now, the area, as shown in the picture, is not as sealed. It doesn't have that nice thick layer of epidermis over it to protect it yet. It's still a bit raw. So you can rub bacteria into it a little bit easier than you could. So, but either way, you just leave it alone. It's going to heal fine. It's going to, if it does have the ledge effect, and I can't really tell in this photograph, it's nothing very pronounced. It's going to seal up on its own, so not to worry about that. I want to talk in general about how a donor area looks after a procedure. Almost everybody's donor area, once you comb the hair away, will look worse right after a surgical procedure. The number one reason for that, of course, is because the area has been shaved. So, and not just the strip area, but a little above and a little below. So instantaneously, it's going to look thinner than the other areas that haven't been shaved. Certainly 5 weeks is not enough time for all the hair to grow back and get to the same length as the hairs that are around it. So you'll always perceive a little dip in terms of the density of hair. Secondly, the hair transplant itself can have a retarding effect on the regrowth of those hairs because the surgery has stunned that area. You can call that a mild shock loss if you want. Shock loss is not a real medical term. It's a slang and it's used inappropriately a lot of times online, but it's good enough for now. When you get shock loss in the area, you may get a slowing down of the regrowth of the density of the hair above and below the scar. But usually you'll see below the scar more thinning. And we can call that a mild shock loss. I've never seen it not come back. I've never seen it not return. Even in the worst repair patients, I've seen an area could be as much as ½ an inch beneath the level of the donor line scar. And it gets very thin. And then in the months that come, it just gets thicker and thicker and then ultimately goes right back to normal. So you may be seeing that also. That's certainly going to accentuate it. And if I remember your case correctly, you already started off with a very thin donor area. So if you're thin to begin with, then it's going to be easier to see where the scar is. But when you see everything heal up and your hair goes back to its normal length, it should blend right in and be difficult to almost impossible to see, just like most people. So not to worry about that. That seems all normal. Certainly you wrote here that if you called my office, I wouldn't be able to tell you anything. I would have told you this, and maybe you would have felt better. But that's okay. I'm happy to put it onto this video so that other people who are no doubt have these concerns will be able to benefit from your concerns. So we'll leave it at that. If you have any questions, of course, you can call the office. But just leave it alone. Try not to keep touching it. It's human nature to keep going back there and checking, especially since you're so concerned about it. Scar stretching either will stretch or it won't stretch. There's nothing you can do about it. There's nothing anybody can do about it. Some people claim if you use onion extract, it may minimize the amount of scarring. I don't know if it's true. If you want, you can go to like CVS and buy one of these creams or ointments that they sell, and you can smear it on there and report to us if it makes a difference. I personally don't think it's going to make any difference at all. But the scar, from what I see in the photo, looks exactly how it ought to look for where you are at this stage. So grow well, heal well, and try and forget about the surgery. Try and forget about every aspect of it. You'll drive yourself crazy. Just let your body do what it does. You've gone this far letting it do what it does, but it's done a fine job without your help. Leave it to do what it wants to do and heal up. And you won't get so stressed out about it. So good luck, grow well, heal well, and I'll see you soon. And this is Dr. Alan Feller. You can find me at fellermedical.com. Take care. See you next time.